Good morning, everybody. Welcome to this hearing, Universal Healthcare. Now is the time for Medicare for All. I want to thank the Congressional Progressive Caucus and our chairman, Mr. Kassar, for hosting this hearing with Congresswoman Dingell and me. And I want to thank all of you, our witnesses, for being here and for the work that you're doing. Congresswoman Dingell and I are going to operate the hearing as if it were a real hearing with opening statements from our witnesses and 4 minutes of questions from our members. We have a timer here to help folks keep track of the time, and we will alert you when your time is up. Since we have several members here, we're asking particularly our members to make sure to stick to your time. I now recognize myself for an opening statement. Our country is in the midst of a massive healthcare crisis with a healthcare system that systematically puts profits over patients. Donald Trump and Republicans' big bad betrayal bill stripped healthcare from tens of millions of Americans by slashing Medicaid and refusing to extend the ACA tax credits. Meanwhile, for-profit insurance companies have figured out how to game the system even further, charging more and more for insurance premiums, copays, deductibles, and other out-of-pocket costs, and vertically integrating the industry to force patients into their own clinics or pharmacies. Thanks to Republicans' cuts to health care, insurance premiums in my district have spiked even more, and many Americans are now paying $20,000 a year simply for their health insurance. Doctors are now being overruled by AI models that deny care and create insurmountable barriers for patients to get the care they need and deserve. Private equity has forced small clinics and providers out of business, and hospitals are shutting down across the country, including in many rural areas. Patients are nickeled and dimed for every bit of health care, while the cost of pharmaceutical drugs continues to be higher than the same drugs cost in any other wealthy country. And meanwhile, all of our frontline workers are being squeezed in multiple ways. On top of this, so many patients, seniors, veterans, children, face very long wait times or travel long distances just to access the care that they need, meaning many patients don't access that care at all. Today in America, the richest country in the world, 95 million people are either uninsured or underinsured, meaning that they have some form of insurance, but it simply isn't enough to cover the care that they need. Today in America, we have $220 billion of medical debt, and we have the sad status of being the only country in the world where getting cancer can cause you to go bankrupt. This is just wrong. Americans know it, and across the country, they're calling for transformative change to our healthcare system so that they can have control over their lives again. The only bill for truly universal healthcare in Congress that can meet this moment is the Medicare for All bill that I am so proud to lead with my colleague, Congresswoman Debbie Dingell, and 112 additional colleagues. Our bill is a comprehensive piece of legislation that builds on the existing extremely popular Medicare system by expanding it to cover comprehensive benefits like dental, vision, and hearing, long-term care, mental health, reproductive care, while also expanding it to cover everyone, not only our seniors. Medicare for All provides you with a government insurance card from birth to death. No more losing insurance when you change jobs. No more worrying about coverage if you want to start a small business or be an artist or a musician. No more fretting that you won't be able to go to the doctors or hospitals you need to go to. No more waiting until you turn 65 to get health care. Medicare for All allows you to see the same doctors and hospitals you go to now. No pre-authorization, no exclusions, no out-of-network doctors and hospitals. You get health care when you need it, where you need it. That's what the richest country in the world should provide, and it is what every other wealthy country already provides. Our Medicare for All bill envisions transitioning to this system over 2 to 3 years. We would start by lowering the eligibility age of Medicare, covering all kids, and expanding coverage to include dental, vision, and hearing, essentially year 1 of our legislation. We know we need to roll back the terrible cuts that Republicans have made. That is a must. But we also have to recognize that we need a whole new system, an actual healthcare system, not a sick care for-profit system. that denies care to millions of Americans. Medicare for All is the only real solution, and across the country, Americans are agreeing with us. Across the country, the latest polling shows that 90% of Democrats, 60% of independents, and 1 in 5 Republicans, even in the toughest districts in the country, are ready for us to make this change. So now it's up to us to finally enact a system that provides health care coverage, not just for the lucky few, but for actually guarantees health care as a human right for everyone. We need a system that can't be manipulated by corporate interests that have shown that they will game the system and put profits over patients at every opportunity they get. We need a system that brings down costs for working families and generates real savings for the country. That is exactly what Medicare for All will do. I will now recognize my co-chair, Congresswoman Dingell, for her opening remarks.
Thank you to my colleague, Jayapal, for all the work she is doing on this and her dedication to the issue, and to Greg and the entire CPC for holding this important hearing to highlight the need, the urgent need for Medicare for All. And thank you to everybody that is here. We can't be quiet. We can't stop talking. We're making progress. And I've never not talked about this since long before I ever got here, and you can tell the difference on the ground. People want health care and think every American should have it. Period. It's long past time for the United States to join every other industrialized nation in the world in guaranteeing health care as a right for everyone. And so if you don't think that it's a human right, like if you're sick, you should be able to go to the doctor when you need to go to the doctor and get the medicine that you need. For those great capitalists, and I'm not, again, I mean, that didn't sound right. The fact of the matter is that we're competing in a global marketplace where other companies don't have to pay the cost of health care. So we should be able to make an economic argument to those that don't seem to understand the human side of this. We've all heard too many stories of people who didn't seek treatment or aren't taking the medicine that they need because they can't afford the bill that would follow. And too many people are making the choice. It's not theoretical. Do I take this pill or do I put food on the table? Countless lives have been lost because people don't get the treatment they need and deserve because they can't afford it. And for me, it's simply unconscionable, especially in the wealthiest nation on the earth. A healthcare system that ties coverage to employment will always leave patients vulnerable. We can and must fix this system. You know, we've been fighting this fight since the 1940s. And look, I'll be honest, I have a very personal, I'm going to get this over the finish line before I die. And I don't plan on dying soon, but I'd like to get it done. My father-in-law helped author the very first universal health care bill that led to the creation of Medicare. And John Dingell introduced, as you all know, the Medicare for All bill every year that he was in Congress, and he sat next to President Obama as he signed the Affordable Care Act. So we've made progress that unfortunately Republicans in Congress have tried and in some cases have succeeded to roll back in the big ugly bill. But here's the fact of the matter. The time is now. This system has been broken long before the big ugly bill was passed. And here's what we really need to focus on, that we spend twice as much per person on health care compared to other countries that have systems like Medicare for All. And we still have 28 million Americans without insurance and an increase in the number of people uninsured since 2023. And we have worse outcomes, including low life expectancy and higher infant mortality rates. The only people benefiting and the people who don't want us to improve this system are the corporations who are profiting while Americans are struggling. It's true. Now, in the face of drastic Medicaid cuts and a party in power that cares more about the rich getting richer than lowering costs for working families, millions of Americans are frightened about pre-existing conditions, escalating prescription drug costs, and what happens to their coverage if they lose their job. The time is now. It just is now to ensure every American has quality health care. This is a critical moment that we can't allow to pass us by. We have the opportunity to put forward policy proposals that'll make people's lives better, counter to Republicans' current plans to cut everything down. And we've got to draw the contrast and show the American people who are fighting for it, who is fighting for them, and who is putting the big ideas forward. Understandably, American people are frustrated. Too often, Congress makes fixes around the edges, and we don't address the root causes that have created a system that puts the well-being of patients second to CEO salaries and profit margins. Now, I wish we could snap our fingers and make Medicare for all the law of the land overnight, but now is the time to do the work to get a single-payer healthcare system that levels the playing field and expands Medicare to cover services like dental, vision, hearing, and lowering the age of eligibility. Moves us closer to the kind of system America deserves and are demanding. Our witnesses today will help understand what those steps look like, why they're necessary, and why we cannot compromise on our ultimate goal, guaranteed health care for every single American. It's a basic human right. And I promise, we're both promise, everybody at this table, that we're not going to stop fighting until we get this done. We're not. And now we're turning to our witnesses for their opening statement. We welcome all of the witnesses and thank them for participating in today's hearing. We ask that each of you keep your testimony to 4 minutes. Our first witness is Ms. Chela Garcia. She is a volunteer organizer with the People's Lobby Education Institute, a member of People's Action Institute. She's a community organizer and will share how her experience with our current healthcare system has driven her support for Medicare for All. Ms. Garcia, thank you for being here, and we look forward to your testimony.
Me? Okay, hold on. Good morning, esteemed Congressional Committee members. My name is Chela Garcia. I am 52 years old, and I am a survivor of domestic violence. I am a member of the unhoused community, not by choice, but by circumstance. I'm also a leader for the People's Lobby and for the People's Action. Also for the Little Village Community Council, which I've been a member since I've been 15 years old. I am an organizer for Guaranteed Income. I am a community leader for Holy Ground at Healthyhood, and all of those positions dedicated to my community. The role that I am most proud of is being a mother. I never thought that it would be possible or have that opportunity in being a mother, but due to medical issues, and that miracle happened. And with that miracle, I still have medical issues that I'm dealing with today. Every morning I wake up and I take medication for my diabetes and high blood pressure, because without them, I do not get to live a life that is diminished because of my health issues. And I am furious. Let me tell you what furious looks like. Furious is waking up every morning with type 2 diabetes, high blood pressure, diabetic retinopathy, which means I'm slowly going blind, and polycystic ovarian syndrome. All of that while wrestling with a body that carries borderline personality disorder. Furious is knowing that the therapy that I desperately need to rewire my brain to stop the spirals, to actually have a life that to live in, that instead of just surviving, that therapy is either unavailable or unaffordable. Or interrupted every single time Medicare decides to shuffle my coverage like a deck of cards. Do you know what it feels like to finally open up to a therapist and trust in them, your trauma, your panic, your darkest hours, and then get a letter saying that your plan no longer has your provider in network? And then you have to start all over again with a stranger that doesn't know your history, doesn't know your triggers, and has a completely different philosophy about your care. I've done that several times, 7 times in the past 10 years. I have ripped open old wounds with a new doctor because some bureaucrat in a cubicle decided that my life was a paperwork problem. That is not healthcare. That's cruelty by clipboard or paperwork. And the delays, prior authorizations that take weeks while my blood sugar spikes, referrals that get lost, and then denials, then the appeals, then the denials again, and then by the time they approve my procedure for retinopathy, my eyesight has worsened, and by the time they approve a new insulin regimen, I've already spent 3 nights in the ER because I couldn't afford the brand that actually works for me. They don't see my face. They see the cost center. They see the line item, and they are perfectly comfortable with me deteriorating while they process. I'm disgusted, and I'm disgusted that I have to beg for my own survival. I'm disgusted that my people in my community allow my fellow Americans are treated like recycled garbage, to be sorted, and not human beings to be healed. Oh, okay, sorry. Well, that's all I have. Thank you, thank you.
Thank you so much, Ms. Garcia, for sharing your experience with us. Our next witness is Dr. Diljit K. Singh. Dr. Singh is a women's health advocate and an integrative gynecological oncologist in clinical practice since 1999. Dr. Singh received her medical degree from Northwestern University and master's degree from the Harvard School of Public Health. She completed an obstetrics and gynecology residency at Johns Hopkins Hospital and a gynecological oncology fellowship at the MD Anderson Cancer Center. She completed her doctoral degree in public health on cost analysis at the University of Texas School of Public Health and an associate fellowship in integrative medicine at the University of Arizona. She currently serves as the president of the Physicians for a National Health Program. Dr. Diljit, you're recognized.
Thank you so much, Representative Jayapal. And thank you for the opportunity to speak about our urgent need for Medicare for all. My name is Diljit Singh, as you all heard, and as a practicing gynecologic oncologist, I do not exaggerate when I say our healthcare system is in dire straits. Every day in my clinic, I see patients struggling with the cost of healthcare. A woman who's getting chemotherapy who can't afford her nausea prescription. A patient who's forced to choose between an MRI copay or groceries this week. If you walked in my shoes through my clinic, you would know this is no time to be tinkering with options and unproven reforms and all the complex regulations that we hear about. It's long past time for Medicare for all. I take care of a part-time elementary school teacher whose health plan did not cover routine preventive care. Instead of getting regular pap smears over the years, she arrived in my office with advanced cervical cancer, right? Completely preventable disease. She underwent radical surgery, followed by chemo and radiation, and all that fundamentally changed her body, changed her life, and still, of course, she has no guarantee of cure. I have another patient, works 2 part-time jobs. Because she's got 2 part-time jobs, she doesn't have health insurance. She ignored her abdominal pain until it doubled her over, ended up in an emergency room where she was told she had a potentially cancerous mass. She came to see me for her care, and thankfully, it turned out to be a non-cancerous ovarian cyst cured by surgery. Even in this best-case medical, scenario, right, curable cancer, she is now thousands of dollars in debt. right? A treatable, curable medical problem absorbed all her children's college savings and her retirement money. I'm speaking to you all today not just as a clinician, but as the president of Physicians for a National Health Program. We're an organization of 25,000 healthcare professionals nationwide, and we are working to achieve universal single-payer healthcare. Free from corporate middlemen, free from deductibles, free from prior authorization, free from the fear of medical debt. Similar countries, as we've heard in the testimony already presented, similar countries around the world provide care to everyone while spending half of what we spend. Yet we die younger, we face higher maternal mortality, we lose more newborns. We have already spent the money, but at least 35 cents of every healthcare dollar is wasted on insurance administration and corporate profit, not spent on patient care. The root cause of this failure is the corporate takeover of healthcare, where financial interests take complete precedence over the sacred oaths we take as physicians to prioritize our patients' health and to make evidence-based, patient-centered decisions free from third-party interference. At PNHP, we did a 2-year study talking to doctors about working in our profit-driven system where financial goals dictate clinical care. We found that doctors, just like nurses, suffer from profound moral injury. Moral injury, that acute psychological harm caused when systemic barriers prevent you from providing the compassionate, patient-centered care you know that patients need. When the drive for profit outweighs patient health, professionals and patients alike are betrayed, driving clinicians out of medicine in increasing numbers. Reversing this crisis requires recentering healthcare on patients and aligning with its true mission. The most common sense solution is single-payer Medicare for all. When everybody has guaranteed access to high-quality care without financial barriers, physicians can focus on taking care of patients, and patients can trust that the recommendations they're getting are not based on corporate bottom lines, but on what they actually need. Doctors, nurses, and patients understand we need Medicare for all. We need Congress beyond you all in this group to hear us and to act with all of the urgency that this deserves. Thank you for allowing me the time to speak.
Thank you, Dr. Singh. Our third witness is Jamie Brown, president of the National Nurses United. Jamie, we love the nurses. She is president of the NNU, the largest union of registered nurses in the country with over 225,000 members. President Brown is also a Michigander and currently works at Beacon Kalamazoo Hospital. She also served as the president from 2019 to 2024 and is currently treasurer of the Michigan Nurses Association. President Brown, thank you for being here, and we look forward to your testimony.
Good morning, and thank you, Chairman Kazar and Representatives Dingell and Jayapal. As she said, my name is Jamie Brown, and I'm a registered nurse from Michigan. Nurses are guided by a simple principle. Every human being deserves dignity, safety, and care. Yes. Only under a single-payer Medicare for all system can we guarantee safer working conditions for nurses, better patient outcomes, and comprehensive coverage for everyone. Unfortunately, in our current system, hospital executives prioritize profits at the expense of our patients' well-being. Our employers are incentivized to understaff our units to cut labor costs, which forces nurses to take on dangerously high patient loads. When we are required to care for too many patients at one time, there is a higher risk of preventable medical errors, avoidable complications, increased length of stay, and higher numbers of hospital readmissions. On top of that, the U.S. experiences extremely poor health outcomes. Despite spending more money per person on health care than any other country, our system forces patients to delay life-saving care because they cannot afford medical bills or debt. Now, even more patients will delay care. The Republican passed H.R. 1, and the expiration of the Affordable Care Act premium tax credits is expected to strip coverage for more than 16 million people. Nurses are prepared to see even more patients ration their medications, delay or forego care, and rely on already overwhelmed emergency rooms for care. In the worst cases, patients will die unnecessarily. Hospitals are also vulnerable to the precarious nature of our current system. NNU found that due to H.R. 1, more than 600 nonprofit and community hospitals are at risk of closures. If these hospitals are forced to close or reduce services, patients will have to travel further and wait longer for care, and nurses will lose their jobs. We can do better. We can guarantee high-quality health care to everyone in this country. Under a Medicare for All system, Americans would no longer be forced to forego care due to cost. It would require no out-of-pocket costs for patients for any services, including expanded services under Medicare, comprehensive health care services, including dental, vision, audiology, prescription drugs, women's reproductive health services, maternity and newborn care, mental health and substance use treatment services, long-term services, supports, and more. Patients, their families, and their trusted providers would be empowered to decide their care plan, not insurance companies. Hospitals in rural and underserved areas would have a reliable and equitable stream of funding. The payments and reimbursements model would more fairly and effectively distribute care across the entire system, directing healthcare resources where they are needed most, where health inequities have been identified. The only way to transform our system for the better is to ensure that the profit motive is completely removed from the equation. Other reforms just don't go far enough or could make the problem worse. The public opinion, wrongly messaged as the politically more feasible reform, could cost even more for patients than private insurance. It is the financial interest of private insurance companies to avoid costlier patients. We'd see companies using unethical practices such as narrow networks, tiered cost-sharing requirements, and selective advertising to exclude expensive patients from their plans. Their practices would push sicker, more costly patients into the public option. Now is the time for Medicare for All. Thank you.
Thank you so much, Ms. Brown. Our next witness is Mr. Egan Kemp. He is an expert in healthcare policy, including single-payer systems, private health insurance, Medicare, Medicaid, the Children's Health Insurance Program, the Veterans Health Administration, the U.S. Food and Drug Administration, social determinants of health, mental health, and drug shortages. He serves as a healthcare policy advocate and previously served as senior policy analyst at the U.S. Government Accountability Office. Mr. Kemp, I now recognize you for your 4-minute testimony.
Thank you, Chair Kassar, Congresswoman Jayapal, and Congresswoman Debbie Dingell. Members of the Congressional Progressive Caucus, thank you for the opportunity to testify today. My name is Egan Kemp, and I'm the healthcare policy advocate for Public Citizen. Public Citizen is a national interest organization with more than 1 million members and supporters, and for more than 50 years, we've been fighting to create a single-payer healthcare system. I've been studying healthcare policy for more than 20 years, and I know that Medicare for All is the healthcare system that we need. The facts that describe our broken healthcare system are not in dispute. We spend far too much money and get far too little for what we pay. The U.S. has a $5.7 trillion healthcare system that does a better job creating millionaires and billionaires than it does keeping people healthy. And that price tag is only increasing. By 2034, the healthcare spending in the U.S. is estimated to rise to $9 trillion a year. Despite all we spend, Americans are sicker than citizens of peer countries. Americans have higher unmet needs and worse healthcare outcomes for almost any disease that's tracked. Americans rack up massive medical debt when they seek care and face medical bankruptcy as a result. And it isn't just Americans that the healthcare system bankrupts. In recent years, many hospitals have cut back services or faced closure, particularly those in urban and rural areas. And that danger has been exacerbated by reckless cuts to the Affordable Care Act and Medicaid by Trump and Republican allies in Congress. It's easy to look at the U.S. healthcare system and feel hopeless. Americans have come to expect the healthcare system will continue to fail them and often end up blaming themselves for poor health outcomes, as many in the Trump administration want them to do. The companies that profit from our healthcare system are great at trading blame about who's at fault for the obscene prices we pay. Insurers blame hospitals and drug companies. Big Pharma blames insurers and hospitals. Hospitals blame insurers for denying care, and drug companies for charging the highest prices in the world for prescription medicines. What gets lost in this fight are everyday Americans. Healthcare companies line their pockets every day and effectively use that money to stymie attempts at reform. Americans are sick and tired of delays and denials of care and having to struggle through a labyrinth of red tape every time they need care. It's not an exaggeration to say every American has a healthcare story where they or someone they know has struggled to get the care that they need. Even with so-called good insurance, getting the healthcare you need can be a massive challenge. If you had asked me to testify at this time last year, I would not have been able to. I wasn't sure what my future looked like. I had a series of health issues and a cancer scare that shook me to my core. I received high-quality health care because of the union-negotiated health insurance that I have, and it allowed me to get the care I needed without crippling my family's finances. But I was also lucky. Millions of Americans face down a catastrophic diagnosis every year, and I feared I was just going to be another person forced to pay through the nose to fight a deadly disease. Instead, I have mostly recovered, and I sit before you with my commitment to fighting for the healthcare system we need redoubled. The nurses, doctors, and other healthcare providers and the staff that support them made my recovery possible. Fearing the financial consequences of getting ill shouldn't be scarier than fighting the illnesses we'll all face in our lives. Under Medicare for All, every person in the country would finally be able to get the care through the providers of their choice without out-of-pocket costs like copays and deductibles. By improving the traditional Medicare program, by adding needed services and ending out-of-pocket costs, by expanding it to everyone from birth until death, we would finally join the rest of our peer nations in guaranteeing health care for everyone in the country. In closing, I just want to dedicate my testimony today to Audie Barkan, a healthcare hero we lost far too soon, and whose memory inspires me every day to fight as hard as I can. I wish he was here today fighting alongside us for Medicare for All. He wouldn't have given in to half measures that take us further from the healthcare system we need, and we can't either. We must fight for Medicare for All. We must continue to build the movement and finally enshrine healthcare as a human right. Thank you so much.
Thank you. Thank you for remembering Audie this morning, too. And we're glad you're doing okay. Now we're going to move to questions, and I'm going to go to Mr. Chairman for the first question.
Thank you to all of the Progressive Caucus members for attending here today. I appreciate you, DPCC Chair Dingell, and our Chair Emerita Jayapal for leading the charge in this country on Medicare for All. Medicare for All remains, for the Progressive Caucus, our #1 priority for reforming our healthcare system. And we believe that it should be the #1 priority for our Democratic Party and for our country. Mr. Kemp, thank you for speaking about my dear personal friend, Audie Barkan, as well. And whenever we talk about winning universal health care coverage in this country, one of the first things that Republicans or corporate politicians ask is, how will we pay for this? So I have a few questions about what we're currently paying for under our current health insurance system. So Mr. Kemp, can you tell me, how much did the CEO of United Health Group make last year?
Shockingly, $61 million.
More than $60 million. And the CEO of Cigna?
$23 million.
How about the CEO of Elevance, formerly Anthem?
Also $23 million.
So just for 3 CEOs, do I have this right? We're paying more than $100 million a year under our current system.
Yes, and they'd like it to be higher.
And no one seems to ask how we can afford that.
Right.
Now, before anyone accuses me of just picking on CEOs, let's talk about lobbying for a minute. How much did United Health Group spend on lobbying last year?
Around $13 million.
How about America's health insurance plans?
About $17 million.
How about Cigna?
Cigna, about $8 million.
Now, this might be obvious, but how much money will we spend on health insurance companies lobbying if we have a Medicare for All system?
Close to zero.
So we never ask, but there's just enormous sums of money that go to these corporate middlemen, to CEOs, to lobbying efforts. And it's my sense that corporate media, corporate politicians never question that money because it's going to their friends or to their donors. But we need that money going to you all, to taxpayers and patients and healthcare providers, back to the American people. That's why we can change to a Medicare for All system. And we certainly can afford it. But let's talk about the other cost of this broken system where money goes to CEO salaries instead of to patients and to people. Everyone knows it and accepts it's normal, but it's a real scandal that while CEOs get rich, millions of Americans don't have health care. In my home state of Texas, 1 in 5 people have no health insurance, the highest uninsured rate in the country. Ms. Brown, you lead a union of over 200,000 nurses. Can you tell me how many Americans would be uninsured under Medicare for All? About how many folks? Right now we're at 1 in 5 people uninsured. How many of our citizens would be uninsured? And can you tell me for your nurses what it would mean if we went from, in a state like Texas, 1 in 5 people being uninsured to then every person who comes into the hospital or into a healthcare facility having insurance?
Nobody would be rationing medications, they would be getting the preventative care they need, and they wouldn't be coming into the hospital on death's door.
Yeah. It seems to me that what we can't afford is to stick with this current system, and instead, that's why we're here advocating to make sure that if Democrats regain power, that we organize around the only rational thing we can do, the only thing we can afford, which is a single-payer system. Thank you, ma'am.
Thank you, Mr. Chairman. Next, we're going to move, Pramila and I are going to reserve our questions to the end. Congresswoman Chu.
Well, thank you to all the witnesses here today. I'm Congressmember Judy Chu, and I'm a founding member of the Medicare for All Caucus, and I also serve on the Ways and Means Health Subcommittee, where we have jurisdiction over Medicare and much of our nation's health system. Over the past year, we've seen the largest cuts to health care in our nation's history through Republicans' big, ugly bill. 15 million Americans are expected to lose coverage. Hospitals are under increasing financial strain, and families are facing higher costs just to access care. And it points to a fragmented system. Our healthcare system leaves Americans' access to care dependent on where they work, what state they live in, or whether Congress extends temporary programs. And we have systems meant to deny care, such as prior authorization. So I'd like to ask the panel, as many as would like to answer, what does this moment tell us about the weakness of our current healthcare system? And why do you believe Medicare for All is the right long-term solution and not simply another healthcare proposal, but a fundamentally different approach to guaranteeing healthcare for every American?
I'm happy to go first. It tells us that some parts of the healthcare system are even more at risk than others. The fact that Republicans felt comfortable going after Medicaid and the ACA, felt a little more hesitant to go after Medicare, really highlights that some places are just more likely to be in danger, and some patients are much more likely to lose their care. And because it's such a fragmented healthcare system, anytime there's any change, anytime there's any tweak, it's going to have long-term effects.
Medicare for All will give patients actually more options in who they go see. There won't be any restrictions on the doctors based on your insurance company, and there will be no prior auths.
fortunately, all of the rest of the committee is covering something, so I'm just going to focus on, how this changes for healthcare professionals. It really sucks to be a doctor right now, right? I came here to take care of people. I took an oath 30 years ago when I graduated med school, and I'm unable to hold to that oath, right? I am unable to give people the things I know they need. And for a lot of physicians, they leave practice. For a lot of nurses, they find other things to do because you can't live like this. The only reason I still practice medicine is because I work in Physicians for a National Health Plan, so I feel like at least I'm doing something. So to me, that's why we need it. If we want to save this profession, if we want to save healthcare in America, we need Medicare for all, and we have to get the profit motive out of it for all of the reasons that we've talked about that you all have addressed.
Medicare for all, it would basically mean dignity for the community. You would not have to wait until the absolutely last moment that you could possibly wait to address, a pain that you're going through, something weird that's going on in your body, to only receive devastating news that you have a cancer, you have a disease, something that could have been prevented by having Medicare for all. It would mean that people would actively be able to take care of not only themselves, but their children, their neighbors, for seniors, that they wouldn't have to, again, be rationing medication, for people that they don't have to continuously prove that they are sick, that they're still sick, that they're going to be sick, and not have to worry about the hoops that they have to jump through just so they could get care and focus on their health. It would mean that they wouldn't have to humiliate themselves by not having access to something like dental care or vision care, because those items are tied to medical devices that the profit of those medical devices are more important than the people who use them.
Thank you so much.
Thank you. Now we'll go to Congressman Garcia.
Good morning, and thank you to all the panelists for being here, Chair Jayapal, Dingell, for convening this really urgent and important hearing, because health care should be a basic human right. And I'm very proud that there's a constituent here, one of my neighbors from the Little Village community in Chicago, a healthcare warrior for all Americans, in Chela Garcia. We are not related, though we used to be neighbors, in full disclosure, on the same street at one time, and both of us still live there. But healthcare should not be a privilege determined by your job, your income, or your zip code. Yet millions of Americans continue to delay or forego care because they simply cannot afford it. Even families with insurance are struggling under the weight of rising premiums, deductibles, copays, and prescription drugs, and those delays that you underscored in your testimony, Ms. Garcia. In my district, I hear from families every day who are doing everything right, working hard, paying insurance, and still finding health care financially out of reach. I also represent many immigrant and mixed status families who face additional barriers to accessing care, making the need for a health care system that covers everyone, and it couldn't be more urgent for Congress to act than now. Ms. Garcia, what compelled you to come here today to advocate for Medicare for all, especially when policymakers often debate health care in terms of dollars and statistics, but your story reminds us that these policies affect real people and families. Could you share what navigating that system has been like for you personally, and why you felt that it was important to be here?
So there's many levels. There's many aspects of that. for myself personally, as being a survivor of domestic violence. The loss of my front teeth came from that incident, and I have to face my community daily because $3,000 is what it would mean for me to get dentures. And it might sound like a small amount to some people, but I make $1,000 a month. That is my income. So that is, out of my reach. But not only that, my organization is Little Village Community Council, is the oldest nonprofit in Little Village. So we, are a place where people come when everyone else has told them no. People who, it doesn't matter if your immigration status. So right now, knowing these cuts are coming, as an organizer, I have to organize, in addition to the work that I already am doing, how to access free health care for everyone that is going to get cuts. There's also all these things that go with it. There's a mother that she barely gets to work because her son was born with a perforated anus, meaning that this child, since he was born, he is 3 now. He's had 50 medical procedure surgeries, each one of them having her to be there for at least 7 to 10 days. And she's learned to be a nurse now because she has to take care of them. And in the middle of this, losing her health care because she forgot or didn't get the redetermination on time, having to wait 2 months for that. We have a teacher in our community that she was a teacher with CTU and worked for them for 17 years, fell short of 20 years, and now she makes $13 too much in order to be qualified for Medicare, and she has cancer.
Thank you so much.
Yeah.
I yield back.
Thank you. Rep. Bonamici? There.
Hi, welcome to the hearing. I'm Suzanne Bonamici from Northwest Oregon. Thank you again for being here and for this important conversation. Healthcare is a human right. No one should go without care when they're sick or injured. The American healthcare system, it's broken. We know that. That's why we're here. It's too expensive. It's too complicated. Ms. Garcia, thank you so much for sharing your struggles, telling your story, navigating this ridiculously complicated system. And too many people are left out. We've seen too many of our friends, our neighbors struggle to afford health care. Like my friend Bob, who lost his job, was uninsured, had a medical emergency, and had to sell his house to pay the hospital bill. I guess he's lucky he had a house, but what a horrible situation people have been in over the years. And pretty soon the Medicaid cuts from the big ugly bill are about to make things much worse. Medicare for All will deliver real change by shifting to the most efficient and effective delivery system, one without a for-profit industry in between patients and providers. With Medicare for All, everyone will have access to universal coverage and will no longer fear going bankrupt or going without care when they need it. Now, the Affordable Care Act made some progress. It was an important step in the right direction, acknowledged the fight that it took to get to where we are today. But times have changed since the ACA. People in Oregon and across the country are facing high costs, not just for health care, but for housing, groceries, gas, childcare, higher education. I want to note, nurses are professionals, and we need debt-free higher education. Private equity firms are buying up hospitals and clinics. This hearing is at the right time to say it is the time, it's an opportune time for Medicare for All. So I want to ask each of you briefly, in your advocacy for Medicare for All, what messages are resonating with the public? What are you hearing when you talk about the importance of a single-payer system? Garcia?
You mentioned higher education, right? I am formerly a high school dropout. I did get my GED. I recently was awarded a scholarship to get my bachelor's. And I am strongly considering putting it on hold because these cuts are coming and my community needs my full attention, because I know we talk about cuts, but it's truly death.
Costs are going up everywhere.
Yes.
Briefly, because I do have another question. What are the messages that are resonating?
I think for what I'm hearing is healthcare is a human right. Folks really are seeing what other countries have and wondering why we can't have that.
Agree.
And I
Doctor?
think the other message that seems to resonate is that we've earned it.
Right.
We have earned health care in America for everyone.
Right.
And
We say you deserve better.
absolutely. And interestingly, like the patient I mentioned with cervical cancer, she was ashamed. She was ashamed to tell me why she didn't get pap smears, as though it were her fault that she had crappy insurance. Thank you. And so I think this idea that we have earned this, like the rest of the world, like Egan mentioned,
Right.
I think that's an important message. And certainly we're happy in our advocacy to hear the messages that you all think resonate.
Brown, what are the
The
messages?
fact that you're not tied to your job, that you will have health care no matter what.
That was actually my next question. So if you could expand on that a little bit, because I know young people today, like my kids in their 30s, they've had more jobs than I have had. And when you go from job to job, it doesn't matter if you don't have employer-provided health care because you know you will have health care. Is that what you're?
Well, a lot of young people just forego health care altogether because it's too expensive. I mean, when you're making minimum wage and you have to pay 30% of your paycheck into health care, it's not affordable no matter how you look at it.
That doesn't work. So.
It doesn't.
Well, now is the time. Thank you again for being here.
Thank you. Rep. Meng.
Good morning, everyone. Thank you to the Congressional Progressive Caucus for hosting this important hearing, and especially to Congress members Jayapal and Debbie Dingell for their longtime leadership and vision, and of course, especially to our witnesses for being here to share your experiences, your struggles, your members' expertise, and all that you are sharing with America today. As a CPC member and a longtime co-sponsor of this important legislation, Medicare for All, it's such an honor to be here with everyone in the room today. One of the first speeches that I ever gave on the floor of the Congress was to oppose an attempt by Republicans to repeal the Affordable Care Act. That was in July 2013. In that speech, I shared that about 2.6 million New Yorkers, approximately 10% of my state, did not have health insurance. Today, despite the progress we've made, far too many New Yorkers still don't have insurance, and millions more have health insurance that they simply can't afford. This, of course, as you all know, was supercharged by Republicans' refusal to extend ACA tax credits and their big ugly bill, which has resulted in skyrocketing payments and made health care even more unaffordable. I wanted to ask a quick question of all of you, starting with Ms. Garcia. If Congress would pass Medicare for All, would it lower costs for Americans? This is one of the top polling issues for all Americans in all political parties, and this is potentially an answer. And I was wondering if you thought Medicare for All would lower costs.
Absolutely. You know, the way, you know, I want to say it's just my community, but it's everyone. If they ignore something that starts small and then it becomes complicated, yes, it definitely would lower the costs.
Dr. Singh, would it lower
Absolutely.
costs?
I mean, I think even when you have excellent insurance, you are limited. Oh, I keep forgetting to turn on my mic. Sorry. I don't want to be like a hot mic moment on y'all. But I think that the thing that we know is that even people who have, you know, what's deemed to be excellent insurance are limited, right? They're limited by their copays. They're limited by their deductibles. They're limited by how much a prescription costs. They're limited when, like, their prescription plan changes and they can't get the thing they want. So how would it help costs for everyday Americans? It would eliminate the costs that they shouldn't be paying right now. I mean, I think that number, that 35 cents of every healthcare dollar going to not healthcare, going to profit, I think if we talk to everybody about getting 35% of your budget back, that sounds wonderful, right? We could do a lot with that.
Thank you, Ms. Brown.
It would cost less because there would be no cost on the human life. And right now, we're putting a cost on human life, and it's unacceptable.
It would reduce it massively, for individuals, for small businesses. It would make a huge difference.
Thank you. And I wanted to ask, I want to shout out to our nurses across the country, but especially to our New York nurses. What are your members telling you about how the Republicans' Big Ugly Bill is already impacting their daily working condition and patient care? And if you can fit it in quickly, what could states and localities do to help?
So we did a July 2026 report, a preventable crisis, and we identified 602 hospitals that are already at risk for closures and cuts. And the rural hospitals are getting affected horrendously. In Michigan alone, we've already had 2 L&D hospitals or services closed, and we've got people driving to Wisconsin and in the UP during winter. That's not safe, so it would affect us.
Thank you.
Thank you. Next, we have Representative Dexter from Oregon.
Thank you very much to Representatives Jayapal and Dingell for convening us today, and to our witnesses, thank you so much for being here. And also to my colleagues for standing together for building a healthcare system that works for the people it's meant to serve. I spent over 20 years as a pulmonary and critical care physician, and I certainly resonate, Dr. Singh, with your testimony today. I ran for Congress because I knew, not in theory, but from decades of practice, that we were failing our patients, and the fix wasn't going to come in the exam room. It needed to come at the policy level. Since then, things just continue to get worse. The draconian cuts and the Republican so-called big, beautiful bill will hit hardest the people who can least afford it. But this dark moment is also a decision point where we have the opportunity to build the healthcare system that the American people deserve, and this is too big of a moment for us to fail. So let's be bold, and Medicare for All is certainly that. We can and we must deliver a system where every family gets high-quality, data-driven care from a team of clinicians that they trust at a price free that they can afford. Doing that will require not just delivering affordability, but building capacity, the workforce that we need, and also challenging corporate power, which clearly is extraordinary right now. Dr. Singh, again, thank you for representing the physician voice today, and for your leadership and ongoing discussions of the structural misalignment between core professional medical principles and the healthcare industry's financial objectives. To fulfill the promise of expanded coverage, we must expand the healthcare workforce. And as you mentioned, people are fleeing the practice of medicine right now. What are the near-term and short-term interventions you see as required to ensure that we have a robust and thriving healthcare workforce?
I'm going to let Jamie address the nursing question, but speaking of physicians, we have a huge contingent that is students for a national health program, right? So students understand almost better than practicing physicians that we have to save the profession. And so, when people worry that, people are not going to want to be doctors, people want to be doctors in spite of how much it sucks right now. So I think, we can do things like pay for medical education, eliminate, education-related debt, like some of the conversation we've had around education. But I honestly don't worry about this in the same way we do. We waste a lot of our time filling in forms, checking boxes, doing stuff that is not healthcare. Just give me that time back, and I could take care of more patients, right? So I think it's a legitimate thing to think through and talk through, but if we fix the rest of it, if we make healthcare what it should be, like a wonderful profession that's fulfilling, and even now, I love to do, I have no doubt that the students, the residents that we work with are going to take over and provide the care we need in this country.
Agreed. And I was a student for National Health Plan member long, long ago. Ms. Brown, thank you. I was going to ask you for the nursing and the broader healthcare workforce for your perspective.
So right now, there is not a nursing shortage. There is nurses are leaving the bedside because of the conditions the hospital are forcing us to work at. Under the Medicare for All bill, there is patient ratios built into that bill, so we would be caring for less patients, and it would bring nurses back to the bedside. People are still going into nursing. It is a calling.
Yeah.
Like, we want to be there to take care of the people in their most vulnerable states, and Medicare for All will just drive people back into the workforce.
Very good. Thank you. I'll yield back.
Thank you. Next, I'd like to recognize Representative Adams from North Carolina.
Thank you, and good morning. I am Congresswoman Alma Adams, and I represent the 12th Congressional District in North Carolina. And let me just first of all say that I grew up in Newark, New Jersey, and did not have health insurance. My mom did domestic work. I had a sick sister with sickle cell anemia. We got our medical care from the emergency room. So I work today here in Congress on one of my major H's is health care. But let me just say that this hearing could not be more timely. I want to thank our witnesses for being here today and testifying. But with Republicans' $1 trillion in cuts to Medicaid and Medicare and the new Medicaid work requirements, we're going to see a record number of Americans losing their health insurance. Prescription costs and hospital bills only continue to rise. And the fact of the matter is that most Americans cannot afford health care in this country. Americans, we're fed up with our system, and we want change, and we need it. We're seeing support for Medicare for All at an all-time high, so I thank all of you for being here today. Republicans are claiming they're making legislative efforts to increase transparency and accountability in our healthcare system to lower costs, but those bills are only Band-Aids to a broken system, and what we need is major reform. What we need is Medicare for All. So thank you all for supporting that. Americans should never be forced to choose between delaying the life-saving care and taking on devastating medical debt. That impossible choice has led to many preventable deaths. It's an unacceptable reality. I remember reading about Dr. Martin Luther King, who said of all of the forms of inequality, injustice in health care is the most shocking and the most inhumane. Our country, we have low-income folks, and that leads to poor health outcomes as well. Due to the structural racism in our country, this predominantly impacts communities of color. Dr. Singh, how would Medicare for All address the racial disparities in health care outcomes in our country?
So Medicare for All is going to fix a whole lot of things. I know sometimes people, when I talk about it, they think I'm like a grifter for Medicare for All, because I'm like, it's going to fix that, and it's going to fix that too. I will say we have a lot of work to do. So simply by giving everybody access to health care, we'll start the process. But we have to acknowledge there is systemic racism built into our healthcare system. That's not just about the corporate system. That also has to do with the academic, part that it's built on. So it'll be the beginning. I think of it as a beginning, but we still have a lot of work to do. And I do think, we mentioned this idea of paying for medical education. Certainly right now, the cost of medical education changes who becomes a physician, who comes into the workforce. So that would be a step to take. I think there's lots of things we can do to address disparities. But the one thing we can't imagine is that Medicare Advantage, for example, is going to help. We know that they've hurt, right? We know that corporations have hurt us.
Let me speak to the labor rights issue in healthcare. Ms. Brown, as the president of the biggest union of registered nurses, could you speak briefly to the impact that Medicare for All would have on the larger labor movement?
It would take healthcare off of the bargaining table and allow us to focus on working conditions, our retirement, and wages.
Thank you very much. Dr. Singh, many of your members work in hospitals that are already facing the high rates of uncompensated care. So how would Medicare for All help hospitals stay open, continue serving rural and underserved populations?
Medicare for All means we would do it based on need, not on where to make money.
Great. Thank you very much, and I yield back.
Perfect timing. Thank you. Next, I'd like to ask Representative Tlaib from Michigan for her questions.
Thank you so much for all of you for being here. One of my residents, it was a few years ago, said, stop calling it health care. It's sick care. And it just kind of sits with me because I know what she means. The sicker we get, the more money they make. And yeah, I was taken aback. You know, sometimes my seniors are so wise and have watched over the years the inhumane, broken systems that are created, and they're handed crumbs and saying this is the best we can do. But I want to bring in my district a little bit because I think sometimes folks don't understand when we say Medicare for All what it means, or what do we say when we talk about it's broken. I want to tell you the story about Sean from Detroit, who's 67 years old. The majority of his budget goes directly to his health care costs. He said, quote, to me, no matter how well a person plans for retirement, health care costs are so exorbitant until they impede on your ability to enjoy life. So it's not just about living, right, and staying alive. It's about being able to thrive, right? Robert from Dearborn is living with consequences of greedy insurance companies, and this one got me so angry. He was recently forced to switch his insurance plans. Before he switched, his diabetes medication kept his blood sugar stable. But his new insurance, Blue Cross Blue Shield, I'm going to say Blue Cross Blue Shield, you know who refused to approve his prescription. The medication would cost $1,600 for a 90-day supply. Since being forced off of the medication, his A1C has risen sharply. Robert put it plainly, quote, I do not understand why an insurance company can decide what I require for my health, or why they override the decision of my doctor. This is a human cost of treating healthcare like a commodity, right? We spend more on healthcare than any other wealthy nation in the world. But in Michigan, the top insurers are proposing rate increases for 2027. It's a crisis in Michigan, and you wonder why people are running on Medicare for All instead of expanding Affordable Care Act, because this is what's happening in Michigan. This is, again, proposing rate increase of folks, a median proposed increase of like 14%. United Healthcare requested 25% rate increase for Marketplace enrollees in Michigan, a 25% increase for families already struggling between paying rent or seeing a doctor, right? So, Ms. Garcia, can you see a healthcare, can a healthcare system like the one we have today put patients first in the way the system is now? No.
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 No. It's
Absolutely
impossible.
not. Now, Mr. Kemp, how would Medicare for All remove the profit interest of insurance companies to ensure healthcare decisions are made based on patients' need and not profit?
Yeah, it's a great question, and I think you spoke to this, that right now they're incentivized. Yeah. There wouldn't be the profit
The thicker
motive.
you get, the more money they make.
Exactly, and and because you switch insurance 10 to 15 times in your life, they don't have any incentive to keep you healthy. Medicare for All would have every incentive to keep you healthy throughout your life.
And everybody always thinks, oh, you're dissing Affordable Care. No, it's not. It covered more people, but more people had to pay out of their pocket.
Right.
So I'll leave you with all this. I get asked, we all do, how to get paid for it. I love going to the Pentagon budget, don't you?
Yeah.
So the Pentagon is slated to, I'm being serious. The Pentagon is being slated right now to buy more than 2,400 F-35s totaling $1.7 trillion. Now you can say, well, maybe we need them. Hold on. They are flawed. Some of them can't freaking get in the air. 800 defects. Do you know what's costing us $38,000 per hour? Literally, to put them in the air because there's so many defects, waste and fraud. Go there first, and don't tell me we can't afford it, because I'm telling you, since the 1980s, they've been charging us crazy amounts for toilet seats in the Pentagon budget, and they just failed their 8th audit in a row. You want to pay for health care and have my residents stop calling it sick care, go to the Pentagon budget, and we'll find the money. Thank you.
Thank you so much, Representative Tlaib. Next we have, I'd like to recognize Representative Grijalva from Arizona.
Thank you. My name is Adelita Grijalva, and I proudly represent Arizona's 7th Congressional District. You know, I grew up in a Superfund site. Both my parents did. They went to the same high school and drank poison water for like 10 years, right? We didn't know it. So in my family alone, I have a nana, a grandpa, a tia, a dad that have all died of cancer. I had a hysterectomy young, so did my sister. And the reality is that once those things happen in a family, that is in your bloodline. Now my children and their children are going to have to worry about this kind of chronic illness. That is environmental racism. And unfortunately, what happens in our communities is nobody's held responsible but the community. So when we talk here in Congress, we talk a lot about arguing over minor fixes, little Band-Aids on our dysfunctional healthcare system. I am so proud to be a part of the Congressional Progressive Caucus, who is actually talking about solutions to this critical problem. And so I'm proud to be here, and I'm proud to be here with all of you. I was here earlier, had to run to a press conference about immigration, also important, and now I'm back here because these are two critical issues. Right? We must address the underlying causes of this sickness of the system, not just treat the symptoms. The symptoms of our current healthcare system are the highest out-of-pocket expenses for people in any high-income nation, the highest amount of medical bankruptcies, the highest national spending by far, worse health outcomes, delayed and denied care, and higher preventable deaths and lower life expectancies. The outcomes are especially terrible for people who are lower income, people of color, and people who live in rural communities. That's a lot of Southern Arizona. So the causes are political choices made right here in Congress. For decades, lawmakers have made the political choice that it is okay for the rich to have access to quality health care and the rest of us to be priced out. They have sided with profits over survival, campaign contributions over primary care, defense and war spending over prevention and public health investments. And we have world-class cutting-edge innovations and treatments that are too little, too late for the vast portion of our population, like many of the ones that you spoke of, doctors. This dysfunctional healthcare system is a failed American experiment, one that has cost us way too many lives. So my first question is going to be for Egan Kemp. Mr. Kemp, one concern raised by critics of Medicare for All is that it would lead to long wait times for procedures. Yet I hear constant complaints from my constituents in Arizona that are delayed or denied care because of prior authorizations that are all being done by AI at this point, right? In fact, a survey found that 78% of physicians reported that prior authorization often and sometimes results in patients foregoing care, period. And 94% of physicians reported that prior authorization delay in patients' access to necessary care. What is your perspective on how wait times would change under Medicare for All when compared to our current system?
Yeah, compared with our current system, right now there's not even a line to get into. People can't get the health care they need because they know that if they do, they're going to go bankrupt. Oh. And so finally, under Medicare for All, we would be putting the healthcare system's entire priority towards serving patients instead of serving profits. And so, and we have a lot of primary care physicians, a lot of specialists. And so I don't think long wait times would be a concern for us. We don't see it in Medicare right now.
Thank you. I have many other questions, but I appreciate all of your time. Thank you so much.
Thank you so much, Representative Grijalva. Now I'd like to recognize Representative Beyer from Virginia.
Thank you, Madam Chair, and thank you very much for putting this together. Thank you, all of you, for being here. Mr. Kemp, I appreciate that your testimony talked about the very real problems with Medicare Advantage. This month we get to celebrate 61 years of Medicare. More than half of the people who should be receiving high-quality, accessible health care through Medicare have been shifted to the private Medicare Advantage plans. As you rightly pointed out, those plans don't keep people healthier. People get fewer choices of doctors, while private insurers pocket outsized profits, as we know from the Ways and Means Committee with abundant upcoding. So today, insurers take home nearly twice the margins on Medicare Advantage plans compared to any other insurance offering, paying more for less choice without better outcomes. Mr. Kemp, can you talk about how Medicare for All would shift the benefits back to patients and give people more choices for in-network doctors?
Yeah, compared to Medicare Advantage, right now traditional Medicare really focuses on the patients, and Medicare for All would supercharge that, really emphasizing adding additional benefits, throughout people's lives. The challenge with Medicare Advantage is it was promised to lower cost. It was promised that it was going to save us money and serve people better, but it really just served corporations better. Every time that Congress has tried to change Medicare Advantage to, focus on sicker patients, how do you handle sicker patients? The Medicare Advantage companies just found ways to game the system, and that's the real danger. Whereas under Medicare for All, they wouldn't be able to get away with that. There wouldn't be Medicare Advantage. There would just be traditional Medicare that's improved and for everyone.
Yeah. Thank you very much. Ms. Garcia.
Yes.
Thank you for your patient perspective. You talked about time and time again the many narrow margins that make the difference of whether or not someone receives health care, like the $13 difference between Medicaid coverage and being pushed into a flawed Medicare Advantage plan, or prior authorization. The big ugly bill did exactly the opposite, right? With the work requirements adding excessive bureaucratic friction that'll lead to less coverage and less care. Forcing patients to do more paperwork, often to drive hours to get to the place where they can do the paperwork. How, Ms. Garcia specifically, how will the new work requirements, work in parentheses, impact you and the members of your community?
In addition to further humiliating them, right, to be of service to wherever they could get these work hours, it then again puts them at risk. It puts them at risk of being further exploited, of meeting some odd contribution so that they could get access to something not only that they deserve, that it is their right as an American citizen to have access to medical care. So when someone is already sick, when someone is already addressing so much of their personal health care, to further put them to work for this, that doesn't even make sense, because people would be able to contribute on their own to build in their community versus, to prove I'm sick, now I have to work for this. It's just humiliation.
Great. I only have 30 seconds left, maybe for Dr. Singh. One of the concerns I have, the whole notion of tied to your job, that right now 60% of the people under 65 actually get their health insurance through their job. And as we saw 15 years ago with the ACA debate, many of them wanted to hang on to it. How do you envision the transition from those 60%, some of whom would love to not be tied to their job, but many of them look to their employer and say, hey, I'm giving me my health insurance, to get to Medicare for All from where we are today?
I think if we promise people that they will have what they have now, but better, they would take it, right? So I know I hear that often, but I don't hear that from the people I take care of. That, hey, I really, really want to stay in this crap job because I really like my insurance with its prior deductible, with the deductibles and everything else. I think we've made that up. I don't think people feel that way.
Thank you so much, Representative Beyer. I now recognize Representative Stansberry from New Mexico.
All right. Well, good morning. Thank you all for coming and sharing your stories and your expertise. I'm Melanie Stansberry, and I'm proud to represent New Mexico's 1st Congressional District. And my one question as we sit here today is, why is it that the U.S. government always has money for war and bombs, but they do not have money for health care and our children? Yesterday, Secretary of Defense Pete Hegseth sat in front of the Senate for hours and told senators that they had already spent over $36 billion on this war over the last several months, and that is the same cost that it would have cost to extend health care for millions of Americans last year when they made the choice to allow health care to lapse for tens of millions of Americans. And instead, they used that money for bombs, to kill children overseas. If you don't believe that's wrong, then I don't know what's wrong with you. I want to just use my time this morning to talk about not what's wrong with the system, but to talk about the belief and imagination we have to get to where all of you are advocating for. The United States of America is the only industrialized country in the world that has failed to create a baseline universal healthcare system. It's not because it's not possible. It's not because it's not technically feasible. It's not because we can't afford it. It's because we have failed to elect officials who are willing to go 10 toes down and to fight for health care to make sure that every single American has access to health care. Now, other countries' universal health care systems are not perfect. I visited some of these places, and that's fine. But there is no person in this country who should go bankrupt because they can't afford to get health care. There is no person that should die because they're afraid to go to the emergency room. There is no person that should live in a rural and tribal community in this country who can't access basic care in their communities. That is moral depravity. Healthcare is a human right. It is the most fundamental right, like food, water, and access to dignity as a human being. Healthcare is a human right. And so I am so grateful for the work that our Progressive Caucus is doing to advocate for this being the primary piece of our platform as we move forward. Because I believe that America is truly at an inflection point. In the 1930s, after the Great Depression, during the Great Depression, the United States actually had the opportunity to adopt universal health care, and other countries during that time chose to do so. Now, we did some big things during that time. We passed Social Security. We created the modern labor protections that have been talked about here today. We created the precursors for many of our modern food assistance and other programs that were fully realized in the 1960s and 70s. And so what I want to say here today is bringing universal health care into the 21st century is the unfinished business of the prior generations. And I do believe that will be our business, not only in the next Congress, but when we win back the House and then we win back the presidency. Now, in the meantime, we got a lot of work to do. I am trying to do my part for New Mexico by bringing home millions of dollars for healthcare clinics through my community-funded projects. I'm working to create emergency care systems. We're funding behavioral health clinics. We're doing mobile healthcare clinics. But that is not enough, and the American people should not settle for table scraps. We need to demand healthcare for all, universal healthcare, and we need to continue to fight until it's a reality, because that is our generation's fight.
Thank you, Representative Stansberry. I now recognize Representative Takano from California.
Thank you, Chair Jayapal. Republicans have cut more than $1.1 trillion in health care spending last summer, and now the President and Secretary Hegseth are asking the American people to spend $1.1 trillion in defense funding. The only way can boo for that. The only way that congressional Republicans and the administration could find money to fund their war of choice is by cutting health care for over 10 million people. And there's another path forward, one where we can invest in the American people instead of conflicts abroad, one where we can save money, and more importantly, thousands of lives. One that is, in fact, really America first, and one where we implement universal health care. So I would like to start off my questions with Mr. Kemp. In your testimony, you say that Medicare for All will save nearly 20% versus our current system. That is more than $1 trillion in savings, if I'm not mistaken, if I read your testimony correctly. Right. How much will universal health care save in prescription drug costs for Americans?
Yeah, well, we would have huge savings in prescription drug costs. I mean, we're already seeing right now, just in the small amount of drugs that Medicare is negotiating, we're seeing big savings. We see that when VA buys drugs, they're even cheaper than what we're getting for Medicare negotiation. So imagine that, but on behalf of the entire country. So huge savings.
So, the small number of drugs that we were able to get under the Biden administration, I think 10 drugs per year. The VA has been doing that for decades, which is to use its immense buying power to negotiate with the drug manufacturers. And Medicare is even a bigger pool of patients. How much in total will be saved this year? Will be saved every year. How much will be saved every year if we move toward? I mean, we went through the exercise of this when we were looking at how much money we could save, not with just 10 drugs, but if we negotiated completely, that would have paid for a lot of stuff.
Yeah, billions of dollars, hundreds of billions.
Hundreds of billions of dollars. That's one way we could pay for universal health care as well. This is saving on medications. In our current system, administrative costs like insurance company marketing are passed down to the consumer. I mean, just all the ads that people get. How much would universal health care save in administrative costs?
Similarly, hundreds of billions of dollars, and it's only getting worse.
Great. Let's talk about the savings that will impact individuals. Right now, more than 10% of my constituents are uninsured, and tens of millions of people across the country can't afford health care, even though they have health insurance. They're still paying out of pocket thousands of dollars in co-pays, co-insurance. Ms. Brown, how often have you seen a patient delay or forego necessary care because they're afraid of how much it will cost?
Every day.
Every day, you see it every day?
Every day. It's not without fail.
How does this impact the patient's health when they have to forego the care?
It's detrimental. They're coming into the hospital sicker, and sometimes we're not able to fix that, and they die.
And, how would universal health care change your job as a nurse?
I would see patients that are actually receiving the health care they need and deserve, and not foregoing food or housing because of it.
Not having to make those choices. I'm fighting for a different future, a future where every single person has health insurance, where medical bills do not cause families to go bankrupt, and where people do not have to choose between medication and, as you say, putting food on the table. I will continue to fight for a system that is fair for all Americans. Healthcare is a human right, and I yield back.
Thank you so much, Mr. Takano. I now recognize Representative Randall from my home state of Washington.
Hello, good morning.
Morning.
Thank you all so much for being here for such an important conversation, a conversation about how we actually move forward on policy that is very clearly important to the health and safety of our country and our neighbors and our future. I've said this before, so forgive me if you've heard it, but my why in politics is absolutely about the meaning of health coverage and access to real health care. Not for me, but for my younger sister, Olivia, who was born in 1993, the same year that Washington State led the country in expanding Medicaid. So because of Olivia's disabilities, she had very expensive health needs. My dad worked for the Department of Defense at our naval shipyard, had good insurance, but it wouldn't have covered everything. The medical equipment, the wheelchairs and inflatable vest and feeding tube and surgeries and specialists. Because Washington led the country in expanding access to Medicaid, because people like you fought for it to happen, we didn't have to worry about losing our home or getting Olivia the care she needed. That was a really formative experience for me when I learned that government could do good things for people. But 1993 was a long time ago. Mm-hmm. And I have heard story after story after story from families like mine who didn't get a program that Expand to cover them, who are having to make the tough choices about what they're not going to pay in order to get care, or knowing that skipping this next appointment because the copays are too high or because they haven't reached their deductible and they just can't make it pencil in their budget is going to put their life at risk. Like my colleagues have said, this is not a choice that citizens in our country, in an industrialized nation, should be having to make, especially when we are spending the money it would take to transform our system on so many other things. I've seen the progress that Washington made, my Washington, not just in 1993, but in the last 10 years, when we have worked on additional subsidies so that folks could buy insurance on the exchange, continued Medicaid expansion for postpartum coverage. We've worked on drug price negotiation. We've passed a universal health care commission that is some of the strongest state-based universal health care policy to pass across the country in the last 10 years. And, as we have heard before, none of this is enough. This hodgepodge system that doesn't get to the root problem, that doesn't ensure that everyone can count on the care and coverage when and where they need it, is a ticking time bomb. More people are dying, more people are making tough financial decisions, all while we are choosing to spend money on other things. I'm so grateful to you all for being here, and I have 20 seconds left, so I'm just going to pose these questions that I know the answer to, and hopefully you can follow up and we can continue, our values-based discussion. But Jamie, I know that you have worked on negotiating health plans for your members across the country. Imagine what kind of bargain your nurses could come to if you just removed health care from the discussion. Imagine how much further you could get for wages and benefits and a contract that truly valued you as individuals. You wouldn't have to fight state by state for meal and rest break protections, for example. And Shayla, Ms. Garcia, we know that the costs are high to implement a system like this, but we know that not acting is higher. So I just want to thank you for your continued advocacy and telling us what the risks are and forcing us to take action. Thank you, Madam Chair.
Thank you so much, Representative Randall. I'm now going to recognize myself for 5 minutes of questions. And I want to start with you, Mr. Kemp. One of the things that we are hearing as people who benefit from the current system are realizing that this really may be our moment to move Medicare for all is all kinds of options that continue a hodgepodge system. And one of them is that we should have go back to the idea of a public option or a Medicare for those who want it. And I want to ask you what you think about that, and whether you think that would be a good idea.
Yeah, I don't think it would be a good idea because I don't think it meets the moment on policy, and I don't think it meets the moment on the politics. That it's really on the policy, you have the big risk of it being a second Medicare Advantage. So something that insurers can take advantage of, can find loopholes, can continue to bilk the system, can what we call adverse selection or cherry picking and lemon dropping, putting sicker folks into a public option, which threatens it in the long run. By making the costs even higher. And on the politics, it's just not where the people are. The people are behind Medicare for all. People are excited. People are demanding it. You're seeing it in race after race across the country. It's time for Medicare for all, and folks aren't going to be happy with a half measure.
And I want to follow up. Yes, absolutely. I want to follow up with the cost question because this is something you've spent a lot of time on, and there are a lot of people who say, well, we just can't afford it, and of course we know we can. But tell me specifically how the cost of Medicare for all actually reduces the cost on overall healthcare spending for the United States, but also for people in their everyday lives.
Yeah, it's a crucial point, and I think the reason people have a hard time understanding it is because we can't fathom it from inside the U.S. healthcare system. But when you look at what other countries do, how much they spend, we see, other countries can do that without a challenge. The reality is, if we implemented any other comparably wealthy country's healthcare system, we would be saving money right now. More people would have access. No other country has ever considered moving towards the U.S. healthcare system because they know it would cost them more, and all of a sudden they would all lose their elections because they implemented something that doesn't work.
Even in the UK, when it's been proposed by some conservative folks to get rid of the NHS, which is a different system than what we're proposing here, there's been a huge outcry from across the spectrum. Dr. Singh, I want to go to you because there was a study that was done out of Stanford in 2021, and it actually found that there was an increase in cancer diagnoses at age 65 compared to ages 61 through 64. And the reason was because people didn't seek care. They didn't actually go to get diagnosed and see a doctor until they got Medicare at the age of 65. And so given that you yourself are in this particular line of work, I want to ask you what the consequences are of people delaying care, especially with diseases like cancer. There are many others where if you don't get an early diagnosis, you may have a death sentence put on you. What comments do you have on that?
A lot of members of the caucus have brought up this issue of preventive care, and it's very clear some 60 to 75% of cancers are completely preventable if we did all the things that we could. That, one of the very interesting things that came of that Medicaid deprivatization study we did, there's arguments that it takes a long time to prevent cancer, and what they saw in Connecticut when they deprivatized their Medicaid was very, very quickly they dropped their cancer rates and they started seeing improvements in cancer survival, right? So that says in a very short time we could prevent cancers, we could keep people from ever having to go through all those fears. And the truth is no cancer is curable.
Yeah.
And if we did all the little pieces that we could do to prevent, that's a job I'd love to be out of, right? Let's get rid of oncologists. We don't need them anymore.
Well, I don't think we're getting there too soon, but no, I think this is very important. It goes to the cost question too, because most of the cost estimates don't estimate what would happen if you had preventive care early on and people were able to get the care they needed and they didn't get as sick. Absolutely. There's some estimates of how many lives we would save. Ms. Brown, I want to ask you about the nursing. I thought you said it very well when you said there's no nursing shortage. There's the fact that nurses can't operate under the conditions that they're given. And I just want to ask you to tell me just one or two stories of what nurses have to go through in this for-profit system when you're dealing with your patients and trying to get them the care that they need.
So nurses are taking care of, on a medical surgical unit, up to 8 patients on day shift. That is not enough time to address every single need. So in turn, you've got patients and families getting angry, and then you've got the workplace violence issue. We're not getting breaks. We're not getting lunches. We are at our breaking point. So they leave, and I can't blame them for leaving. So this would force it would take the profit out of healthcare and make it about the human.
Thank you. I'm going to use the prerogative of the chair to end with a question to Ms. Garcia and just say thank you so much for being here and for the work that you're doing in the community. If we had Medicare for all, where people knew that they had insurance from the day they're born to the day they die, what changes would you see in the community around you and the idea that they wouldn't have to fear getting sick without health care?
That would be an absolute cultural shift. And people would be able to engage on everything that's there in their community. I know that I would be able to meet additional mothers at the local school council. I know that there would be people that would be able to share culture, to share art, to develop our community for safety. All these things are prevented, or they're stopped, and they're stunted because people are sick. Mm-hmm. People just don't, have the will to go out and fight when they have to address things like uncontrolled sugars or unaddressed mental issues. Mm-hmm. So all of that would be just an opportunity for us to provide for ourselves.
A new future that respects human dignity at its core.
Absolutely.
Thank you so much. I think that is a beautiful place to end, because I think when we think about messaging and what has been resonating for people, one of the big ideas is the idea that you have control over your life again. And healthcare is the essential piece that we need for joy, for freedom, and for basic taking care of ourselves. So I want you to know that we're never going to stop fighting for Medicare for all. I think this is the moment. I know there have been people in the fight for a long time, and we so appreciate you and we hear you. And I think this is the moment where the current system has collapsed under the weight of for-profit insurance companies and all of the entities that stand to benefit. It is going to be a fight to get there. But I actually believe that the American people across party line are with us and are looking for a transformative system where everyone is in and nobody is out. And healthcare is truly a human right. Thank you all so much for being with us, and let's go get this done.